Thanks, Amanda. Well, the Ebola epidemic dominated the headlines this fall when the virus infected several Americans, including Dallas healthcare workers. Well, crisis averted, but tonight the LBJ Library is holding a forum on the Ebola response here in Texas, and two of the panelists are here to give us a preview. Dr. Philip Huang is the medical director for the Travis County Health and Human Services, and Rico Reyes is with the LBJ Library's Future Forum. Thank you both so much for being here this morning. And Dr. Huang, I wanted to start talking about the crisis when it came to Texas. Thomas Eric Duncan eventually died from Ebola and 2 nurses were infected. How did you feel about the way the hospital and Texas handled that situation, and maybe what did we learn?
Well, you know, it was a very difficult situation. I think everyone did learn some lessons from Dallas. I mean, one of the first things is for healthcare workers to ask that question about travel history. You know, in the previous 21 days, had they been to these particular countries in West Africa, been exposed to anyone who had Ebola? You know, I mean, because we do know how it's transmitted, and it requires that direct contact with the blood or body fluids of someone who's been infected with Ebola.
And the threat is not over. Obviously, it's still going on right now in Africa, even though it's been removed from many of the headlines here. If something were to come up again, how do you feel about our preparedness?
You know, I think that it's part of the public health response that we deal with every day in terms of infectious disease reporting, following up on cases. I think that, again, people have certainly learned lessons from what happened in Dallas. We've been working with our medical providers, the hospital systems, EMS, all of them. So I think that, you know, it's very unlikely we will see anything here, but I think that we're prepared.
Mr. Reyes, talk about this panel discussion that is happening tonight and what you hope comes out of it.
Yeah, thank you for having us, first of all. So the LBJ Future Forum itself is designed to serve as a center for vibrant public discussion, and as you said, Ebola has dominated the headlines this fall. One of the things that the LBJ Future Forum would like to do is serve as a touch point to allow people with everyday questions to come and ask the experts in a much smaller environment and give you access to experts that you otherwise wouldn't have. In this case, we have Clay Jenkins coming down to tell us exactly what he experienced when he had to lead under pressure. We have Dr. Huang, we have Linda Watkins, who's a nurse, and will give us that important perspective. We have Sarah Eckhart, who's our county judge-elect, and you know, she may not have been involved in the Ebola virus so far, but if it comes back, she's going to be stuck with the consequences. And we also have Tony Marquardt, who will represent EMS, and Tony says we're not ready. And so one of the things that we'd like to do is get all of that out on the table. Let's find out, where are we strong, where are we weak, what's the truth, and what are the politics and optics of it. And we'd like to try to get that sorted out, balance, you know, what may be fear with the facts.
Yeah, should be an interesting discussion. Austin did play a role. Many of the blood samples were tested here. So the discussion continues tonight, 6:30 over at the LBJ Library. Rico Reyes with the LBJ Library and Dr. Philip Huang with Travis County Health and Human Services. Thank you so much for being here this morning.
Thank you for having us.
Thank you.
I appreciate that.